Hi, my name is Landon. We're going to be doing a health assessment today. Generally, when we do a health assessment, when we meet our patient for the first time, we're getting a first impression of everything. When we watch them come in, we're looking for their general appearance, their cleanliness, their mobility, how they're getting around, if they need any assistance, their gait, excuse me, the range of motion, if there is any stiffness or anything like that, any general involuntary movements, how they're dressed, if they're dressed appropriately for the weather, if they're seem clean, if there's any odor going on. Also, we're doing an ongoing skin assessment. Every time we go through something, we're going to be checking out the skin color. And so we're going to get started. I'm going to go ahead and kind of assess your posture, how you're acting, your affect, your mood. Are you making eye contact or not? Do you seem upset about anything? Can you tell me your name, please?
My name is Cassidy Landon.
Okay, can you tell me where you are right now?
I'm at home.
Okay. How about the year? What year is it?
2014.
Okay. And can you tell me the name of the president?
Barack Obama.
Okay. So basically I'm just assessing her level of consciousness, her orientation. She's alert, oriented ×4. Her speech is clear, and obviously she can hear me because I'm not having to increase my voice for her to hear me. So then I'm going to just kind of start at the top, work my way down. I'm first going to do an inspection of her scalp and her head, making sure she's normocephalic, making sure there's no lesions, lumps, bumps, any abnormal swellings or anything like that, which I don't see anything. So then I'm going to go into the palpation. I'm again going to palpate her scalp, looking for any depressions, swelling, lesions. Sorry. Okay, any tenderness?
No.
Okay. Also, while I'm doing this, I'm going to be kind of checking out her hair texture. I'm checking for parasites, anything like that. Okay, so everything looks good there. And then we're going to go on to your face. Again, I'm going to do an inspection, visual inspection first, looking for symmetry, her affect, her facial expressions, if there's any involuntary movement, anything like that. Her face is symmetrical, her eyebrows are symmetrical, palpebral fissures are symmetrical. Nasolabial folds are symmetrical, lips, everything looks good. Skin, we get a little bit of a breakout, but otherwise don't see anything. Good skin tone, no excessive moisture or dryness or anything like that. Okay, so now I'm going to palpate. I'm palpating for her temporal arteries. Yep. Right. I'm going to palpate her temporomandibular joint. Can you open your mouth for me? Can you close it? I'm checking for smoothness, any problems, any soreness. Alright. Alright, so I'm also going to go ahead and palpate her sinuses. I'm going to do the frontal first. Any tenderness there?
No.
Not maxillary? No.
No.
Okay. Alright, so then we're going to go on to the eyes. Again, visually inspect, make sure the lids cover the upper portion of the iris, which they do. You can close your eyes for me. Make sure the lids are approximate completely, which they do. Okay, go ahead and open them. Are you having any problem with your vision?
Mm-mm.
Do you wear glasses, contacts?
Yes.
Contacts?
Yes.
Okay. Alright. If we had a Snellen chart, we would utilize that. You would stand 20 feet away and you'd cover one eye, read the chart, and then switch to the other eye, read the chart, and we'd assess from there. So, what we're going to do is, excuse me, I'm going to check your pupillary response first. I'm going to shine a light in your eye. Okay. Okay. Sorry. Now what I'm going to do is I'm going to shine a light in one eye and check for the concentric reaction in the other. Okay. Okay, I'm also going to check for accommodation. Can you watch my finger here? Okay, as the my finger gets closer, her pupil should constrict and her eyes should converge. Okay. Okay, very good. Okay, so I'm going to have you follow my finger. We're going to check the 6 cardinal movements of her eyes, which tests cranial nerves 3, 4, and 6. Okay, we're going to go up first. Taking care not to do it too fast. It won't cause her to be dizzy. I'm also going to do what's called a corneal reflex test, or corneal light reflex test. Basically, I'm going to shine the light in your eyes, and I'll make sure the light is in the exact same spot in both eyes. This is to test for, to make sure that your eyes are aligned. Okay, there. Okay, there you are. 2 more tests we need to do with your eyes. I'm going to have you cover your right eye. I'm going to cover my right eye. Alright, this is called confrontation test. Okay, tell me when you can see my finger.
I can see it.
Okay. Alright.
Got it.
Okay. Alright, now, one more test. It's called a cover test. I'm going to have you cover one eye. Okay. I'm going to have you focus on my finger here. So now, when you uncover this eye, I'm going to check to see if there's any movement back to midline. If there is, that means there's some weakness in the eye. Okay, go ahead and uncover your eye. Okay. I'll try to focus again. Cover the other eye, please. Alright. Focus. Okay. That's good. Alright, so we've got the eyes. We're going to go ahead and inspect the sclera. Okay. I'm going to have you look at for me. Alright, so sclera should look white, kind of pearly white, and the eyeball should be moist. Okay. Alright. Okay. Also check the conjunctiva for any swellness, redness, anything like that, and everything that looks nice and pink. I'm going to check your corneas. I'm going to kind of come off to the side here. Have you look straight ahead. Kind of shine light in your eye. And while I'm also doing this, I'm going to check your anterior chamber. Okay. I'm also going to check your tear duct here. Press down. There should not be any fluid come out whenever I press down. Basically, I'm checking to make sure it's patent and it's actually draining. Okay. So we've got. Let's see. We've got that. All right. So I'm going to go ahead and do your ears. Now, if I had an otoscope, that'd be great, but I don't. So, so basically, what I'm going to do is I'm going to just inspect the outer ear, look for any lesions, swellings. Do you have any tenderness?
No.
Okay. Looking for any drainage coming out. Like I said, obviously she can hear me because I'm not having to speak louder for her to understand me. Okay, so if I have an otoscope, I'm going to be shining it into the ear canal, checking the ear canal to make sure there's no redness, any swelling, anything like that. And I'll also be checking the tympanic membrane. Tympanic membrane should be like a pearly white. There's no redness or swelling out. That's good because it's going to get wet. Alright, so what I'm also going to do is we're going to do what's called a whisper test. Okay, I'm going to stand behind you. I'm going to say two words. What did I say?
5 and blue?
Yep.
Okay. 9 and red.
Okay, very good. Okay, so we're going to go ahead and inspect your nose. Symmetrical on your face again, midline. No obvious deformities or anything like that. Have any trouble breathing? Any sinus problems? Okay, we're going to check for patency first. I'm going to include this. Go ahead and inhale. Okay, inhale. Okay, we're going to look up your nose here. We're checking for any deviated septums, redness, swelling, discharge. Check the turbinates out. Everything looks good there. Okay. Now we're going to go onto your mouth. What I'm going to do, I'm going to have you open your mouth for me. Alright. First of all, I'm going to check your buccal membranes. I'm going to go ahead and have your tongue back in your mouth for me. Just open this open wide. There you go. I'm going to check your buccal membranes first. Make sure they're pink. No lesions. Moist. Okay. Looks good there. Hard palate should be pink. Pink to a white with no patches or anything like that. No lesions. Looks good there. You stick your tongue kind of out and down. There we go. Right now I'm looking back at our tonsils, making sure they're not swollen. No exudate. Okay, can you say ah? Ah. Okay. Soft palate goes up along with the uvula. So that's good. Alright, stick your tongue back out for me again. Checking for the surface of the tongue. Should be moist. You can be a little rough. Pink. Okay. No patches, no lesions, or anything like that. Look on the sides here. Okay. That's good. Okay, I'm going to have you kind of stick your tongue up to move your mouth up a little bit more. There you go. Good job. Okay, I should be able to see the veins. Nice and smooth, glossy. And I'm going to look at the floor of the mouth for any lesions or any problems like that. Okay, that's good. Okay, one more time. Give you a rest in between. I gotta check your teeth out. Okay. Your bite is in alignment. And check your gums. Make sure they're pink to a coral. Okay. Lines nice and tight. No swelling. No plaque. Okay. Open up one more time for me. Okay. Oh, ah. Make sure there's no missing teeth. No cavities, anything like that. Okay. Alright. So, we've done the mouth. We're going to go on down to the neck. Again, I'm going to make sure that everything is symmetrical. Your head and neck are symmetrical with your torso. That's good. Your head is held erect and still. Everything like that. Okay. I'm looking for any obvious swelling down in here. Nope. Okay. So, I'm also looking for any obvious pulsations. Jugular venous, the jugular venous distension. Could you do that just a little bit? There you go. Alright, so I'm also going to be palpating your lymph nodes, your trachea, and your thyroid. Okay, we're going to start with the lymph nodes. We're going to do the preauricular first, doing a gentle circular motion. Most normal lymph nodes are not palpable. Posterior auricular. Occipital. Digastrojugular. Submandibular. Submental. Superficial cervical. Then we get posterior cervical. supraclavicular, and your deep cervical chain. Okay. All right. Make sure your trachea is midline. Give you a little squeeze here. Sorry. Okay, so I'm going to have you kind of face the camera so they can kind of see what I'm doing. I'm going to palpate your thyroid. Okay, first of all, have you swallow for me. Okay. So, if I notice any swelling or lumps, which I don't, but if I notice any swelling, I would also auscultate for a bruity. I'll have that right, which everything looks normal there. Okay, so what I'm also going to do is I'm going to test your muscle strength in your shoulders. Okay, I'm going to have you just kind of shrug up against me. Okay, all right, turn your head towards the end of my hand. Okay, very good. Okay, so also we're going to test your range of motion. So what I'm going to have you do is start whichever way you want, but I'm going to have you put your ear on your shoulder. Okay, you can either go back or front, whichever way. Okay, keep on going around. Okay, and to the chest too. Very good. Okay, any pain?
Nope.
Okay. So basically I'm looking for smoothness of movement with no pain. Okay, so we're going to go ahead and do your chest. Let's see, we're going to, I have you face.
Sorry.
Alright, we're going to face that way. Alright, so basically there's several things that we need to check for on the chest. Basically the first thing I'm going to do is check for symmetry of her shoulders. Have you set up real good and straight here. Okay. Make sure everything, her scapula, symmetrical. Okay. I'm going to test for her chest expansion. So what I'm going to do is, okay, take a big deep breath for me. Okay, so we're looking for symmetrical chest expansion there. Okay, so after doing that, we're going to test for, I'm going to do the tactile firmitis. So what I want you to do is, whenever I press down, I'm going to have you say 99 and have a deep voice for me. Okay, go.
99.
Okay.
99.
Okay.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, and also as I'm doing this, I'm feeling for any masses or tender. Do you have any tenderness back here?
No.
Okay. All right, we're going to go ahead and percuss back here. All right, so I'm going to start up here. I'm going to have you face forward. Oh, sorry. I'm going to auscultate your lung sounds real quick. Okay, every time I move the stethoscope, I'm going to have you take a deep breath for me, okay? Obviously, in an ideal situation, you would not have your shirt on, you'd have a gown on so I could be able to listen to. Okay. Alright, so, I'm going to turn back towards the camera, please. And we're going to kind of do the same thing here. I'll check for chest expansion here. Go ahead and deep breath for me. Okay. Alright, we're going to check for tactile traumitis on here as well. See 99?
99. 99. 99. 99. 99. 99.
Okay. We're going to listen for lung sounds, and then we're also going to listen for what's called bronchophony. Okay. Deep breath for me. Alright, so what I'm going to do is I'm going to listen again, and I'm going to have you say just anything that comes to you, okay? So basically what I'm listening for is I should not be able to understand what you're saying, I should just be able to hear it kind of like a garbled.
Hi, how are you? 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 Hi, how are you?
Okay. Alright. So now I'm going to listen to your heart sounds. Maybe sit good and straight for me. Okay. We're going to start with the aortic, which is your second intercostal space, your right sternal border. Just going to have a listen here. Okay, pulmonic, second intercostal space, left sternal border. Tricuspid, right intercostal space, left sternal border. Okay, fifth intercostal space, midclavicular line. Check your apical rate. Okay. 76. And here S1, S2. Rhythm is regular. Alright, and I think that concludes our inspection right now.